back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today we're going to talk about Flexeril, also known as Cyclobenzaprine. It is a muscle relaxer. It can be dosed 1 to 2 to 3 times a day, maybe even more depending on the dose. So I'm really not going to touch dosing at all. That's something for your physicians, for your doctors to take care of. It is a centrally acting muscle relaxant. So what does that mean? It means it won't actually fix the problem. What it'll do is, the way the pain works is whenever you get, let's say you get hurt here, you get hurt in your shoulders, it sends signals up to your brain to say, ow, 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 and that's why you feel the pain. So what this does is it comes in and it cuts off that delivery of signal. So essentially, that area is sending signals up to the brain, but the medication is cutting it off, meaning your brain doesn't think that it's in pain. So it kind of cuts it off that way, and that's why you don't feel pain. That's how pain really works. It's not because you actually hurt yourself and you feel it. It's that fact that you hurt yourself, and it sends electrical signals to your brain saying, ow, ow, we're hurt, you're going to feel pain, to let you know that there's an injury here. But when it cuts off that pathway, you don't feel anything at all. I mean, you'll still be hurt, so it doesn't fix anything. This is the big thing that I let all of my patients know on Flexeril or any kind of these muscle relaxants, is they don't really work. Now, those of you that are older, if you remember Quaaludes from the 80s, same sort of stuff, just very potent. It also gives you a high. That's Quaaludes. But they work, these muscle relaxants work by just completely cutting off signals to your brain. So that gets to be kind of dangerous. Well, Quaaludes were. Flexeril is not so much dangerous. It's okay. And really, the way that it actually cures the muscle aspect of it is that because it cuts off the signal to the brain, your body is able to heal itself. You give your body time, because if you're constantly hurting, then you're not able to go about your day-to-day work or whatever it is that you need to do, and you're just impaired. You're just hurting all day long, and that doesn't help. But if it can cut off that pathway, it allows your body to heal. And generally, if you're in a car accident or some sort of sports injury or something, you're generally taking other medications with it. You're taking anti-inflammatories, which actually do take down inflammation. So if you get hurt somewhere, it'll take down the inflammation. The cyclobenzaprine will cut off the signal to the brain so that you don't feel pain, and that's kind of how it goes about fixing what it does. So it can be taken with or without food, does not matter. For people with hepatic impairment and liver issues, make sure your doctor knows before you start this medication. Dosages will need to be tweaked. Here is a list of the common side effects. The only one really worth talking about that I think happens in the majority of the population is this dizziness. It essentially kind of zonks you out. Zonking you out meaning you kind of just fall asleep. It makes you sleepy. So watch out for that. A lot of people actually can use this medication without making them sleepy at all. It doesn't. But I always tell people, if this is your first time taking Flexeril or Cyclobenzaprine, however you want to know it, take it in the evening when you're home from work and you don't need to go anywhere, and you can take the medication and see what it does to you. If it makes you dizzy, it makes you pass out, then okay. Then you know not to drive or do things like that. Like you know not to take it during the day, essentially. But if you're able to function, then hey, you're able to function. It's not a control medication. It's not known to have any sort of like abuse potential or anything like that. It's generally a very well tolerated medication, does really, really well. And if you use it in conjunction, you don't abuse the medication, then it's a great medication to use for issues that you have regarding muscles. So guys, I hope that helps. I think that's everything. I think I covered everything. If I haven't, I'll put something at the end of the video. But again, thank you for tuning in. If you have any detailed questions, please forward them to your doctor, your local pharmacist, or give us a call here at Telfair Specialty Pharmacy. One of us would love to talk to you about it. And leave any comments, notes down below. Help us improve these videos. That we're making them for you. That's really what they're for. So we want to make sure we help as many people as possible. So we want to put all the information that you guys want in these videos. So let us know if we're leaving something out. All right, guys, thank you so much for tuning in. We'll see you next time on Meds Made Easy. Bye-bye.